All right, so this pretty much has all the nerves, well, a lot of them anyway. So, you ready? All right, so this right there, that's olfactory, cranial nerve 1. Cranial nerve 2 is right here with the optic chiasm. That's the chiasma. That's the optic. Right here you can see number 3. This one. 31 is 3. 44 is 4. This is number 5 right there, and then number 6 should be coming from below. It'll be this one coming up into there. All of those go through the superior orbital fissure. 3, 4, 5, and 6. Number 7 and 8 come out of the internal acoustic right here, right, or go through that opening. There's internal acoustic. Numbers 9, 10, and 11 all go through the jugular foramen right here, and then hypoglossal will be going through down below through this. It's this one. It's going through the occipital condyle right there. That would be hypoglossal right there, right. And then of course this one coming straight down would be number 10 from this grouping, going down into the carotid sheath. That's the vagus nerve right there. That's traveling down with the carotid artery. And that's most of them. If we come around here to this side, you can see the ones going to the eye. That would be 3, 4, 5, the first branch of 5, and 6, the abducens. This is cranial nerve 5, so it does the maxillary portion right there. That's going to be maxillary division going through foramen rotundum. That opening right there, that's maxillary. This is mandibular going through foramen ovale, and it does the whole bottom of the jaw. That's mandibular. This would be facial coming through here. That's going through the internal acoustic meatus, coming this direction to do the the submandibular glands. This gland down here would be done by facial, as you can see right there. Okay, and that's the majority of these of the cranial nerves that you need to know. So a quick review. We have going through the superior orbital fissure right here. We have cranial nerves 3, 4, 5, and 6 right there. That's 6. Okay, and then those go into the eye. Cranial nerve 7 and 8 through the internal acoustic. 8 would be going into the temporal lobe. 7 would be coming out through here and doing the part of the face right there on the side. That's facial. It also does the submandibular and sublingual glands for salivary glands. 7 parasympathetics do. And so those go through internal acoustic. Right below internal acoustic is the jugular foramen, which would be 9, 10, and 11. Cranial nerves 9, 10, and 11. 9 does the parotid gland on the side of the face and does a lot of the musculature on the side, as well as pharynx and and other structures that you can study. Number 10 is coming down through this opening along the carotid artery right there and into the carotid sheath. That's 10, vagus. It does all the internal organs except for 4 of them. It's the parasympathetic supply to those. Number 11 right here goes to the spinal accessory. It actually is going to go through the foramen magnum down on the sides of the spinal cord, come back up through the foramen magnum, and then exits through the jugular foramen and goes down into the trapezius and the sternocleidomastoid muscles. And then number 12 is hypoglossal, which we can see up underneath here. It's the one going through the occipital condyle right there, and it does everything underneath the tongue out front. So as the name implies, hypoglossal, below the tongue. Genioglossus is the tongue muscle. And that's all of the cranial nerves, all 12 of them. We didn't review, though, olfactory and optic, which are those 2 out front. These are purely sensory, along with number 8, the vestibulocochlear. 1, 2, and 8 are purely sensory. The others that are mixed, which would be parasympathetic, motor, and sensory, would be 3, 7, 9, and 10. And that means that numbers 4, 6, 11 are all the ones that are both motor and sensory to muscles, skeletal muscles. Okay? Study, that's it.